Hey there, Dr. Mamina here. A lot of you have been asking about my favorite, most effective products for treating acne scars. We all get them and we all hate them. So by having the right skincare regimen in your day-to-day, you can certainly help to erase the scar or scars on your face. But I want you to know that there are different types of acne scars, and depending on the scar, there are different products and procedures that can treat them. So let's get into all of that. So when it comes to evaluating acne scars, I look at two different things. One is discoloration and the other are the textural changes. So when I look at discolored acne scars, there are two specific types. So once that bump on the face is gone, you may notice skin discoloration, and you can see that this is in the form of hyperpigmentation or brown spot or erythema or a red spot. So the first one is post-inflammatory hyperpigmentation, which is a melanin response that can leave a dark mark on the skin. And this can happen if a pimple is really inflamed or if it's like irritated from a lot of picking or squeezing. And this can also result as an injury to the skin, like if you have a scratch or a cut or like UV exposure, like a bad sunburn or a chemical burn. Post-inflammatory hyperpigmentation is more common in darker skin because darker skin produces more melanin. And I have more on that in my previous hyperpigmentation video here. The other form of discolored acne scars is called post-inflammatory erythema, which can appear as pink or red marks on the surface of your skin. Erythema is a vascular response to inflammation or irritation, which can be caused by a lot of inflammation or picking at the pimples or UV exposure, injury, or irritation to the skin. When it comes to treating discolored acne scars like PIH or PIE, I recommend using anti-acne treatment that also can address hyperpigmentation or redness. So things like tretinoin, azelaic acid, and niacinamide. And then other ingredients to think about are like kojic acid and tranexamic acid, as well as exfoliating ingredients like glycolic acid. The other type of acne scar you can get are the textural changes that you can see in scars, which can happen if there's a lot of inflammation or can also depend on the genetics of the person's skin. Textural scars are seen as like depressed or raised scars, so ones that you can feel on the skin. But the type of scar you see depends on how much collagen your body makes or doesn't make while your pimple is healing. So if you make too little collagen in the process, depressions or pits form in your skin. And if you make too much collagen, you can see raised scars, or what we call hypertrophic scars. So when it comes to depressed scars, unfortunately, you almost can never just treat them with skincare. You'll likely need an in-office procedure like subcision, resurfacing lasers, chemical peels. I specifically like TCA Cross. You also may benefit from microneedling or radiofrequency microneedling, or even filler injections into like the deep scars. But of course, it's always best to ask your dermatologist what the best treatment is for your skin. Now, for raised scars or hypertrophic scars, the most effective treatment is in-office local cortisone injections, because that can actually flatten and soften the scar. Depending on the scar, sometimes lasers can also help. And then I think even just simply massaging the scar, that can help. I don't think it's gonna make a big of a difference as procedures, but it's something easy you can do at home. Overall, when it comes to acne scars, depressed scars, or raised scars, there are a few different factors that can play a role. So if your acne bump went deep into the skin, like a deep cyst or nodule, there's a higher likelihood of having a scar. If you've picked, scratched, irritated the pimple, that can also increase your chances of leaving a scar. And then sometimes some people are just more genetically prone to having depressed or raised scars, depending on the way that their body makes collagen in response to inflammation. But genetics or not, there are still ways to help alleviate your acne scars and ensure that they heal. So here's my recommended skincare routine for acne scars for the morning and night. So when you wake up, I would use a gentle cleanser, maybe a gentle exfoliating cleanser. I like the Gliderm gentle exfoliating cleanser, and then apply like some kind of anti-acne treatment that has azelaic acid. Certain brands that make over-the-counter azelaic acid are The Ordinary, 10% azelaic acid. Naturium has one, the 10% azelaic acid, and Paula's Choice also has a 10% azelaic acid. Then of course you want to apply sunscreen, super important when it comes to healing your acne marks and scars. I love the CeraVe Hydrating Mineral Sunscreen. EltaMD has a good one, the UV Clear SPF 46. This one has niacinamide in it, which is nice. When people ask really what the best sunscreen is to use, I tell them the one that you're willing to use every day. So you don't necessarily have to use one of these, but these are just some suggestions. Okay, so then when you're going to bed, same thing. You want to first start by gently washing your face, and then using some kind of anti-acne treatment like azelaic acid. And then afterwards, I would use tretinoin. This might be something that you have to get from your dermatologist because it's a prescription, but you can certainly use like an over-the-counter retinol if you'd like. And then after your retinoid, I would recommend using a moisturizer that has ingredients like niacinamide or Centella asiatica, which can like soothe redness. I also recommend exfoliating 1 to 3 times a week with a higher strength glycolic acid, like the Ordinary, which has the glycolic acid 7% toning solution. I really like the Dr. Dennis Gross Alpha Beta Universal Peel Pads as well, because that has both glycolic and salicylic acid. And I have a full list of my favorite post-inflammatory acne mark treatments in the description below. So by simply following the skincare routine and trying out some of my favorite acne scar products or similar treatments, you can help erase those marks in no time. Well, actually it can take time. So one of the biggest pieces of advice I have is to have patience throughout this whole process. Scars take a long time, okay? And my last 2 pieces of advice and reminders for you when it comes to pimples is to stop popping your pimples and to wear your sunscreen. I hope you found this video on acne scars to be helpful. If you enjoyed this video and you want to learn more about skincare and acne products, be sure to download my free gift, my top 5 skincare favorites. And remember to hit that like button, share this video with your friends, and subscribe to my channel to start your holistic wellness journey for your mind, body, and skin. Thanks for watching.